We actually use the WHO-5 Mental Wellbeing Index from the World Health Organization. This was developed almost about 20 years ago. It uses 5 questions to measure 5 aspects of a person's well-being: physical, mental, emotional, social, and sense of purpose as well. 45% of our users since the start of the year actually show early signs of depression. And within 1 month of usage, we have actually been effective at improving their WHO-5 scores. We have been improving 60% of the employees who have actually used our app.
It's Mandy jumping in on the conversation as well. Depending on your country, depending on your culture, depending on your background, I would imagine that your mental health needs can be very different. So how do you customize to that to those differentiations on your app?
Yeah, absolutely right, Mandy. I mean, cultural relevance in mental health is a huge area of research right now. I mean, it's actually very fast growing. And in MINDFI, we do that at 2 different levels: the technological and the ecosystem, which is the human level. Our AI algorithms aim to actually understand a user's profile and predict their mental states. We're actually working with universities both in the US and here in Asia to actually deepen our algorithms on that. But secondly, you can't just go full technology as well. We work with ecosystems, we work with providers, coaches, psychologists, therapists in up to 14 markets in Asia. Somebody experiencing this in Japan is going to be very different from someone in Indonesia, and we want to make sure that is amply reflected in our product.
Do you expect to see less demand, though, once the pandemic is over, as gradually, one by one, countries start to open up, people get back to a so-called more normal way of life?
Well, I think once this mental health, issue has been open, it's like a Pandora's box in a very good way, right? Now, users are, everyone around the world understands that mental health is not something you can ignore once the pandemic is over. And they also realize that companies are actually willing to pay for it as well. So I think going forward, they will expect this to be a benefit that is equivalent to the insurance plans, the health plans that the companies purchase for them. It's also very important that they learn about mental health, not just in the health perspective, but use this as a way to upskill themselves, improving their career prospects, their leadership skills, and teamwork communications as well.